Well, nursing homes have been ground zero for COVID-19, and as states begin to reopen, new steps are being taken to protect those in nursing homes during the pandemic. Joining us now is CMS Administrator Seema Verna. Seema, thanks for being with us.
My pleasure. Thanks for having me.
Well, tell us about this new announcement by CMS.
One of the things I will start out by saying is that our hearts and minds go out to the patients and the family members. This has been a very difficult time for our nursing home residents. And our announcement this weekend was all about transparency. We want to make sure that patients and their families have the information that they need to make decisions and just to have a better understanding of what's going on in the nursing home. And then secondly, we are having nursing homes directly report information into the CDC. Now, we've had long-standing regulations about making sure patients know what's going on with their family members, and they're also supposed to be reporting into the local health department. But as part of our overall effort to opening up the country, we are working on making sure we have a very solid surveillance system across the country. And that means we're monitoring individual communities to see if there is an outbreak. And by monitoring nursing homes, we'll have a better understanding of what's going on in the larger community. And so these efforts around reporting into CDC are not only about keeping patients safe and providing better transparency about nursing homes, but it's also about protecting the entire community and doing what we can in supporting local officials' efforts to mitigate the spread of the virus.
South Carolina is easing restrictions. Georgia, Tennessee will be following suit. What kind of impact in states reopening, does it put nursing homes at greater risk?
Well, one of the things that we've put in the recommendations that Dr. Birx talks about in terms of opening up the country is that we want to make sure that we have that surveillance system in place and that we are focused on nursing homes because we know that they're the most vulnerable. So we have to make sure that they're prepared and that we have that surveillance system in place. And so those reporting guidelines will go a long way to supporting efforts to opening up the country.
When the coronavirus first hit, we saw the devastating impact it had in Washington State in the nursing homes there. As we begin to reopen the country, there is a chance, a possibility of a second wave of the virus if and when it does in fact hit the country. Are there steps or a plan being put in place now in the event that does happen to protect people and as well as nursing homes?
Absolutely, and I think we're going to be in a different place. We've seen a dramatic increase in testing. We have learned more about this virus. You have to always remember that this just started less than 6 months ago. We didn't even know about this virus in terms of the entire world not knowing. And so we're learning information, and as we learn that, we are constantly updating our recommendations and our guidelines. That's going to be very important to nursing homes that are on the ground that have that primary responsibility of keeping patients safe. But it's also that data and information is informing our larger efforts. But we will be in a different place because we'll have testing. We're also doing a lot of efforts to beef up contact tracing so that if there are some new cases that come up, that we can very quickly make sure that we're doing contact tracing, isolating individuals, and we're hearing every day about new therapies that are also going to be available. So I think we'll be in a different situation if we see a reoccurrence of the virus. But it's important to know virus isn't going anywhere. It's going to be a part of our healthcare system. It's going to be part of the things that we can potentially catch. The important thing is to make sure that we have a system in place to mitigate the spread of the virus, to make sure that our healthcare system doesn't get overwhelmed and that we're doing everything we can to keep Americans safe.
Seema, you are part of the coronavirus task force. I've been in the briefings. I've heard from you. I've seen you standing beside President Trump. What has been the biggest challenge in combating and fighting this pandemic?
Well, I got to tell you that there are challenges, but I've also been just enormously impressed with how the American people have responded to all of this. The recommendations that we put out, 15 days to slow the spread, 30 days to slow the spread, the American people have responded, and it is making a difference. We're seeing all across the country that many communities are seeing fewer new cases. We're seeing reductions in hospitalizations, which is why this weekend we also talked about reopening the healthcare system. We've done a great job with telehealth, but there are just some healthcare services that can't wait anymore. But it has been a major impact. I think the economic impact has been also something that people have just really suffered from. And so I appreciate the fact that the president has had not only a public health response, but also an economic response. Just, last night we heard about new legislation that was passed to provide more capacity around testing and more support for our small businesses as well as hospitals.
Seema Verna, thank you for joining us.
My pleasure. Thank you.